How bed rest reduces pregnancy rates in IVF patients. Most doctors traditionally used to advise bed rest after an embryo transfer, and patients were very happy to follow this advice because they felt that their precious embryos were fragile and that after putting them in the uterus, they needed all the nurturing they could possibly provide. They worried that physical activity would cause the embryo to get dislodged, and they wouldn't get pregnant because their embryo would fall out. No good IVF clinic anywhere in the world advises patients to rest after the transfer because the embryo belongs in the uterus. The uterus was designed to receive embryos and allow them to implant, irrespective of the external physical activity outside the uterus. After all, nature has designed human reproduction intelligently, and once an embryo is inside the uterus, it's as safe and secure, like a pearl in an oyster. A storm raging outside doesn't harm the pearl. This is the reason why women have happily had babies in the bedroom for millennia, no matter what they do after having sex in their bedroom. Physical activity does not affect the embryo implantation process, and an embryo behaves exactly the same way, whether it's been created in the bedroom or in the IVF lab. After all, once the embryo reaches the uterus, it doesn't care whether it spends 5 days in the test tube or 5 days in the fallopian tube because once it's in the uterus, it's safe and secure. If an embryo is going to implant, it will do so, irrespective of physical activity. In reality, bed rest actually reduces pregnancy rates. Also, bed rest adds to the stress because of the backache that it causes, and this makes patients extremely uncomfortable, anxious, and nervous. For one thing, bed rest will reduce the blood flow to the uterus, and this can't be good. Finally, mental stress which enforced bed rest causes makes a bad situation even worse because an idle mind is a devil's workshop. Patients keep on thinking about what is happening to their embryos, and this drives them crazy and make the 2-week wait seem much longer because their mind plays all. This is why many women flatly refuse to do another IVF cycle when their first one fails because they aren't willing to spend 15 days in bed because they know that this will